Hi, my name is Kelly Conley, and today I will be presenting my evidence-based project for advanced nursing practice for NSC 892. What I want to focus on today is childhood obesity, and specifically screen time viewing habits related to childhood obesity. The reason I feel that this problem is significant is because according to the CDC, 1 in 3 American children are considered overweight or obese, and that was in 2015. I did a quick literature review, and what I found, there were a lot of randomized control trials where different researchers were doing different interventions to try to reduce screen time viewing. Some of these interventions were one-on-one, some of them were in schools, a few of them were in a primary care setting. Basically what the researchers found was that in the short term they were able to reduce screen time viewing, but most of the research wasn't done for real long periods of time, so they didn't really see much of a reduction in BMI on the participants, but they did see a small reduction in screen time viewing. So what I gathered from the literature was that there needs to be more education for the pediatric patient as well as their parents on reducing screen time viewing. So the purpose of my project will be focused on what can be done by a nurse practitioner in a primary care setting to help educate pediatric patients as well as their parents on the negative effects of too much screen time viewing. The targeted population that I will focus on will be children ages 6 to 17 years old. So what I propose is when children come into the primary care setting to receive care for any reason, the first thing that will be done was we will do a height and weight assessment and measure their BMI or body mass index. Once you get BMI, you can classify them as either overweight, normal weight, underweight, obese, or morbidly obese, and that will give the nurse practitioners participating kind of a baseline of where the kids are. Next, the parents will be presented with a written assessment questionnaire asking about screen time viewing habits of the child. Once the nurse practitioner has this data in front of them, they will have the assessment tool as well as the BMI. Then they will kind of tailor education for the patient and their parent about the negative effects of too much screen time viewing. I feel that education is all individualized, so the nurse practitioner will kind of gauge where they need to go with the education depending on where the child already is at as far as how much screen time viewing they are actively participating in, as well as where their BMI is. Let's see, the nurse practitioner will provide education about the effects of sedentary lifestyle, including screen time habits, and how this affects child's BMI. We will provide an ongoing assessment. We will continually do the BMI measurement and do the assessment tool and continue the education at each visit that the patient comes to in the primary care setting. All the information that will be collected will become part of the permanent medical record. All items will be written and will only be accessed by medical providers that will have normal access to the patient's chart. Ongoing collection of the data and analysis will be done by the nurse practitioners, and I set a goal of 5 years. I thought in 5 years it would be plausible for the nurse practitioners to be able to compile the data and see where they are at as far as how the interventions have helped. Some expected outcomes that I expect to happen. Hopefully there will be a reported reduction in screen time viewing for the kids. Also, the recorded BMI, hopefully it will stay in the normal weight range. If the child was already overweight, maybe the BMI will stay the same. If not stay the same, would improve. We just don't want to see it get worse. And another expected outcome would be that we really want to see an engagement of the parent and the child in the participation of the one-on-one counseling with the nurse practitioner about the negative effects of screen time viewing and how those affect BMI. Now, I understand that screen time viewing is not the only thing that affects BMI in children. There's lots of other factors, but too much screen time viewing is just what I want to focus on, and really let the parents know that it's not just television. It's computers and cell phones and handheld devices and video games, all the things that we use every day in our lives. Pediatric obesity is really an epidemic in our country, and I really want to become dedicated to helping combat that epidemic. So hopefully when I become a nurse practitioner, I could help implement this practice change in a primary care setting and maybe see a reduction in BMI for pediatric population in my area. Thank you guys for listening to my project.